Good afternoon to everyone. I'm presenting a topic on branch retinal vein occlusion and dyslipidemia, which is a hospital-based case series study, and this is an observational only study. The branch retinal vein occlusion is the most common among all types of RVOs, and in India its prevalence is around 0.66%. Most commonly it is found to affect the superior temporal quadrant, and the common pathology behind it is to be the common atriovenous adventitial sheath and the glial sheath. The visual acuity at the presentation and prognosis usually depend upon whether the macula has been involved or not, and the ocular fundus picture can range from any type of intraretinal hemorrhages, soft cotton wool spots, or macular edema. The Workhouse triad is also believed to play a major role in the pathogenesis. Our aim was to estimate the proportion of patients having dyslipidemia who were diagnosed with BRVO in ocular fundus examination, and it's a descriptive observational case series study where a total of 38 individuals who turned up at our outpatient department in ophthalmology during a period of 6 years were taken up for the study, and the inclusion and the exclusion criteria are given here. Necessary clearance from the institutional ethics committee was taken. The case details, the history, patient history, their personal history, and every detail was entered in a prescribed case record pro forma. After we noted the BCVA and the pupillary reaction thoroughly, we dilated both their eyes with eye drop tropicamide plus phenylephrine, and after adequate dilatation, we examined the ocular fundus with indirect ophthalmoscope and slit lamp biomicroscope with suitable lenses. The ocular fundus findings were recorded as superficial or deep intraretinal hemorrhages, the part of the retina involved, any exudates we observed, or any kind of vascular anomalies seen. The study participants who were diagnosed clinically with BRVO were further counseled to get a serum lipid profile done, and after they had their blood test done, if it was found that it was positive for dyslipidemia, they were further asked to get management for the same. The normal reference guidelines used for serum lipid profile according to NCEP and ATP3 guidelines were given here. The laterality, severity, and the prognosis of the all cases were explained properly, and the management was explained to the patients. The table 1 here summarizes the socio-demographic characteristics of the study participants, and including the gender, the age group that we most encountered. The table 2 here summarizes the clinical findings of ocular fundus, which shows the quadrant it involved, the involvement of macula, and did we find cotton wool spots or not. Out of the 38 study participants who were clinically diagnosed, there were 14 individuals who were found to have BRVO, which accounts for 36.8% of the study subjects, which we consider to be fairly high. And out of these 14, 6 were females and 8 were males. It is found that in most cases of the BRVO, they were diagnosed in the age group of 40 to 60 years, and in the second most group, it was 80 to 90 years of age group. And the BRVO was diagnosed most commonly in the superior temporal quadrant, which amounts to 65.7% of the cases, which agrees to the most common probable pathogenetic factor. 57.1% of the diagnosed study participants were male, and 36.8% of the study participants were diagnosed having dyslipidemia, which is similar to the studies conducted by Agarwal et al. And Sheikh KM et al. In conclusion, BRVO is a potentially vision-threatening disease depending upon the severity and the involvement of macula, where the vision can be as low as 6/60 or less, associated with some metamorphosia. Dyslipidemia has been documented a very important risk factor for the development of BRVO in most commonly in middle age group, and it is sometimes found that undiagnosed dyslipidemia can be found in BRVO who are come with vision person. Prompt management with individualized specific treatment is the goal, and management for dyslipidemia has to be done for a proper holistic approach. Thank you.
Thank you. Any questions from the panel?
Yeah, I just saw your last slide that you've excluded treated patients with hypertension, etc. So when before your study, did you exclude any other comorbidities?
Yes, we excluded any other comorbidities like diabetes, hypertension, or any other forms of venoocclusive or vascular disorders they would be taking medications for. We also ruled out the cases where they might have a history of OCP intake, or who had histories of venous disorders of the legs. So any other comorbidities were ruled out properly.